Hey guys, how you doing? Chapter 32 is what we're going to work on next. Go ahead and get started here. We're looking at spinal column and spinal cord traumas. Exciting stuff. Okay, so anatomy, physiology. Start out most of these just kind of reviewing what we should already know. The nerve system, two major functions: communication and control. Communication is throughout the entire body, communicating with your extremities, movement, your senses, your five senses referred to, and control in making those things move and function. Enable awareness of and reaction to the environment and coordinates body response to changes in the environment as well. Um, Taking a look at the components of the central nervous system, basically the brain and the spinal cord. The peripheral nervous system is all the nerve endings that branch off, all 31 that branch off from the spinal cord throughout the body. The spinal vertebrae column, where that spinal cord slides down, numbered one through, uh, the first seven are cervical, the next 12 are the thoracic, the next 12, or excuse me, the next five are lumbar, and then we have sacral and coccygeal at the very end. Knowing that, important to know that nerve endings stop about here. Everything branches off here. These two pieces are fused together. They can be seen as five and four or one and one, but there is no nerve endings that run through here. It's just creating the cup or the bowl for the pelvis, is what it is. A little protection there. Functional division of the nervous system: voluntary and autonomic, or sympathetic, parasympathetic. Voluntary meaning that it functions on its own. Autonomic means there's some function, you have some control over this. Skeletal system: protection from the CNS, central nervous system. The skull protects that central nervous system, the brain. The spinal cord, spinal column, 33 vertebrae total. The vertebrae bound together by ligaments, and vertebrae are separated by discs. And so these discs make this spine completely flexible, but still allow those nerves to come out and actually not be pinched or impinged upon to allow them to function properly. A series of openings in the vertebrae create the spinal canal. The spinal cord passes through the spinal canal. The spinal cord consists of nerve tracts. All nerves to the trunk and extremities originate in the spinal cord. Spinal cord motor tracks carry impulses from the same side of the body. Pain tracks carry impulses from opposite sides of the body, and light touch tracks carry impulses from the same side of the body. Just understanding how these impulses travel throughout our body. Causes of spinal injuries: vehicle collisions, about 48% of these lead to spinal injuries. Falls, about 21%. Gunshot wounds and recreational activities fall into the rest of those percentages. Only 14 to 50% of patients with spinal cord injuries present with neurological deficits. Improper handling of patients with spinal cord injuries may result in neurological injuries, and a patient may have spinal cord injuries without spinal cord. Hang on, what does that say? May have spinal cord injuries without spinal column injuries. There, I'm sorry, my words got confused. So, in other words, we could have some spinal injury, but there is no column injury that we can actually identify. So, please understand that just because we don't palpate any, deficits, any crepitus or painful, to the touch on the spine, doesn't mean that there isn't a spinal cord injury. It definitely could still be there. We've got to be careful. Mechanisms of spinal injuries, different types of falls downstairs. You have the typical swimming pool, dove into the shallow end. There's the car accident, whiplash type injury. You've got, unfortunately, a hanging. This is internal decapitation, definitely happens. Flexion rotation injury and penetrating traumas as well. So there's a lot of different ways we can injure the spine. It's the most delicate and most important portion for us to protect. And talk about that cervical spine specifically. Column injuries: injuries to the vertebrae, fractures and dislocations results in pain or tenderness. The spinal cord injury disruption in movement or sensation. So The spinal cord injuries themselves are different things we can look at are the fractures, and we notice this with dislocation tenderness. And this could cause cord injuries, disrupting those nerve endings that branch out, pinching on them, severing them, and even on the inside of that column too, causing the same kind of thing. Complete spinal cord injuries, transection of the cord, loss of motor sensory and autonomic function below the site of the injury. Spinal shock also can result in initial presentation with complete loss of function. This is where we sever that cord completely. Neurogenic hypotension, high blood pressure, or low blood pressure based off of the neurogenic side of things. Loss of sympathetic control of the arteries, resulting in vasodilation. So these veins will dilate. This is part of the shock process. Loss of sympathetic communication with the adrenal glands, preventing release of epinephrine and norepinephrine. Adrenaline is kicking into our body, which is going to dilate blood vessels. And the skin is warm and dry and pulse rapid rate is normal. Incomplete spinal cord injuries. Injury does not involve all three tracks. Some, but not all signs of spinal injuries are present. And this is what we're talking about, the incomplete one. The pattern of lost function is reflected in different syndromes. Central cord system syndrome, the medical portion of the motor and pain tract control the upper extremities. The lateral portion of the tract controls the lower extremities. In central cord system syndrome, the medical portion, the medial portion of the spinal cord is injured, meaning the outside edge of that spinal cord is injured. We've got that impingement happening is what's going on. Central cord syndrome. Patients present with weakness or paralysis and loss of pain sensation in the upper extremities. Function of lower extremities remains intact. Anterior cord syndrome, loss of function in the motor and pain tract, but not in light touch tract. The patient experiences paralysis and inability to feel pain below the level of injury, but can detect light touch. And that's going to bring us to the end of that. We'll be talking about emergency care here shortly. Okay. I'm going to go ahead and stop there. I will post this up, and you will also be receiving your case study as well for you guys to review. Okay. Thank you very much. Bye.